that girls with conduct symptoms. How power assertive discipline in families actually form a role model for children to pick up aggressive models of conflict resolution. The former, which is power assertive discipline, I'm telling you, you better do this. If you don't do it, you see what's going to happen to you. This kind of power assertive discipline versus induction or inductive discipline is strongly associated with aggression in children, whereas the latter is associated with helping behavior and a concern for victims and internalization of parents' ethical value systems. The quality of family relationships. Now, all this is important in the kind of management that you do. So when you take history for children like this who have problems, you need to understand the family and the quality of family relationships. Because aggression increases in cases of harsh and abusive tactics in families where there is marital discord, where there's emotional rejection manifested by lack of parental care and lack of proper supervision. The reason for this is, if you look at a child's negative behavior and certain parental commands increasing child aggression and parent increases aggression, the parent withdraws and the negative behavior persists. So you can get into a cycle, and in clinical management of these conditions, it is very important to actually work on parental marital relationships, work on parent-child relationship independent of the problem, work on styles of supervision, and then give them a feedback about this loop so that at some stage you begin to address the nature of your communication and the nature of your physical response to the child so that it doesn't increase childhood aggression. I won't go too much into community roles and interactions, but there is a collective efficacy based on mutual trust and shared pro-social values and community solidarity, which has a strong deterrent to aggression. Families who believe in gentleness, families who believe in social work, families who believe that we need to give back to society. They go to old age homes and orphanages once a week and do seva. These kind of families, children do exceedingly well. Then, of course, there are the peer group influences, what we call as deviancy training. So what kind of friends do these children have? Who do they hang out with? Who are their role models among the peers? This kind of history taking is very important for clinical management. And this is the basis on which we come to the whole section on assessment leading to management. I will stop at this point of time. I see that many people have joined again. Please do use the hand raised option or the chat option to basically put your thoughts or put